Department in the Ministry of National Security. I'd like to thank everyone for coming to the press conference this afternoon. And firstly, this is an operational EMO update. Again, this is an operational EMO update. The Emergency Measures Organization met this morning to assess and review our operational protocols. And we have a plan in process to navigate the COVID-19 pandemic. I recognize there is a great bit of angst and anxiety in our community as it relates to the COVID-19 coronavirus. However, I can assure the people of Bermuda that the government is working hard and around the clock to put safeguards in place to ensure that the people of Bermuda are protected. The purposes of this conference is to ensure that we have concise and key information that is being disseminated at all times. I will outline the key areas where we have pertinent updates as outcomes from this morning's meeting. Any other matters I am happy to address during questions and answers. As you are aware, the COVID-19 helpline has been established to provide support for those who have concerns and questions about the virus. That number is 444-2498. We have had no significant changes since our last health update last night. Airport operations. We want to reiterate that the Aleph Wade International Airport will close for incoming passenger flights on Friday, March 20th at 11:59 for the next 2 weeks. Only returning residents will be allowed on flights to Bermuda today and tomorrow. Non-residents will not be landed on island as of today. Non-residents will not be landed on island as of today. Cargo flights will not be affected. All seaports are closed to visiting vessels, but essential cargo operations bringing food, medicine, medical supplies, and other essential goods will still come and will continue to arrive in Bermuda. As a note for Bermudians or students living and working in the UK or Europe who require immediate assistance, they should contact the Bermuda London office at 440-207-518-9900 or email londonoffice@gov.bm. All returning residents can now complete the traveler screening form online. Again, the form that was made this week and that was being given out by hand can now be completed online. For the forms, go to forms.gov.bm/COVID-19. Go to forms.gov.bm/COVID-19. Completing and submitting the form ahead of time will make your arrival processing much easier. Education. Schools are closed. However, the Ministry of Education is working towards implementing remote learning for the island's public school students. The public sector. The public bus and ferry services are suspended until April 6. Most government offices are working at a reduced level. The government has not shut down. And given the need to increase social distancing and to contain the spread of COVID-19 that has now reached our shores, we must work differently. This would include persons working from home when they are able to do so. Please note that the following legal affairs departments are still operational: National Drug Control, Child and Family Services, and Residential Treatment Services. They, again, will all remain in operation. All other departments in the Department of Legal Affairs will have reduced operations. In all cases, we're asking for the public's patience as they seek to get specific government-based services done. Private sector organizations. As we indicated yesterday, we are strongly advising bars, restaurants, gyms, and other social establishments to shut down their operations effective immediately. As we indicated yesterday, we are strongly advising bars, restaurants, gymnasiums, and other social establishments to stop their operations immediately. To be clear, I believe that restaurants can still carry out takeout services in their organizations, but we believe that bars and gymnasiums and other social establishments should immediately stop their operations. Essential retail outlets will continue to operate, such as food and medicine. The Ministry of National Security. The Royal Bermuda Regiment is embodied to provide support to emergency personnel. The Bermuda Police Service has issued guidelines on how they will assist. The Department of Corrections, all visits will cease. Only visitors who are pre-approved by the Commissioner will be allowed entry for a closed visit. Lastly, before I open up for questions, let me say this is our new normal. We need to do things differently. Residents are strongly urged to adopt social distancing in an effort to slow down and contain community spread. I encourage everyone to visit www.gov.bm/coronavirus, the government's Tree Frog app, as well as other social media pages for official government information. Over the last 2 days, we have seen an increase in social media. Everyone is now sending around WhatsApp messages, and they're now doing forwards on Facebook and in other methods on TikTok and on Instagram. We're asking everyone to use, if you need pertinent information and if you want to be sure that it is the correct information, we're asking you to go to www.gov.bm/coronavirus or download the government's Tree Frog app. I am happy, along with my colleague, the Deputy Director, to take any questions.
Good afternoon, Minister Ms. Trott. Are you able to provide an update whether how customs officers will be able to safely handle incoming arrivals?
Last night, we had a difficult set of circumstances at the airport. If you can just imagine the customs officer seeing someone at a podium such as this, and they were obviously concerned. Firstly, we take the concerns of everyone that is customer facing or public facing. We take those very seriously. The customs officers directly highlighted those concerns to me. I spoke with the deputy collector of customs. He reached out to a local vendor. The local vendor is going to fabricate something that comes directly over that will cover the customs officers as they conduct their operations. That is significant, and that is not something that we take lightly. It will take the person that is fabricating has given us a time frame. We're asking him to accelerate it. We believe in the meantime, we're going to give the customs officers other precautions that they can safely operate and execute their duties. I also believe that there are some customs officers that have not, they did not show up for work this morning. Those roles are being carried out from senior members of the Department of Customs, and those numbers are being augmented by members from the Department of Immigration. I'd like to thank the members of the Department of Immigration under the leadership of Dr. Danette Ming, as well as the senior officers who have stepped up. Again, we don't bear any ill will or malice to the officers that were concerned. This is our new normal. We're now putting measures in place and have been putting measures in place to protect the well-being of the officers, as well as to ensure that the traveling public coming in are maintained specific guidelines at all times.
Have any customs officers or airport staff shown any symptoms, flu-like symptoms, since that flight that was carrying the two passengers on March 4th and 6th? Have any officers experienced symptoms?
Not at this time, but what is clear is that we're going to make all the helping services available to the customs staff or anyone that has been customer facing, that they can get the necessary medical attention if they so desire.
Has anyone from those flights that were carrying the passengers who tested positive, have they been tested?
We, last night, as you can imagine, this is a quickly evolving set of circumstances. Yesterday afternoon, when we received when we received indication that we indeed had positive coronavirus persons in Bermuda, we have notified all the key stakeholders. So we wanted to make the information public as promised without delay. The EMO met last night at 7 p.m. After the EMO met, we started to operationalize plans. Some of the plans that we have is for contract tracing to begin. They have been given key bits of information, and as we receive the information, they're going to notify us, and we're going to give them further instructions as and when they contact the numbers that were given to them.
How can the message get across that this is a change in the situation? You see a lot of people still socializing, still carrying out community events. What can be said to stress the importance and severity of the situation?
I'm glad you brought that up. I too was concerned when I came into work this morning and I saw so many people still going about their regularly scheduled duties. There is an opportunity for us to realize that if you do not need to be on the road, if you are not a part of the essential services, if you are not helping out with any COVID-19 related activities, you need to be at home and inside your premises. That is a clear message that we want to deliver today. We are trying to prevent community spread. It is important for the listening public, for the people of Bermuda, to know that to prevent the spread, we need to have everyone off the roads, and they indeed need to be indoors.
Good morning, Minister.
Good afternoon, sir.
Oh, good afternoon. Apologies.
That's okay.
Couple of questions to start on your prepared statement, if I may. How many people are currently working the hotline that's been established?
I'm not sure of the exact numbers.
Okay. You mentioned that you're strongly advising, particularly bars and social clubs, to shut down immediately.
Yes.
Is there any thought of a forced lockdown of those kind of establishments? Is this something that's being considered?
We believe that we have the legal locus standi or the legal opportunity to do so when we believe there is a medical reason to do so, and the EMO has met and we've considered all the circumstances. We do have provisions in law that we have discussed that things can and will escalate. I do not want to get into the specifics of those measures at this time until we have everyone at the table and we have indeed, in fact, escalated them. But you can be rest assured that when there is a need based on the evidence from the medical, from the chief medical officer, that it's time for us to escalate, those escalations will be made with the full weight of the law behind them.
If I can follow up on some of the line of questioning that Jasmine was asking regarding to the two people who have tested positive to date. We heard last night that one person arrived on a flight on March 4th and the other person on March 6th. Are you able to provide specifics on when those two people were tested?
No.
Are you able to provide specifics on when the results of those tests were sent overseas?
No.
The results were both received back as positive yesterday, correct?
Yes.
Okay. Can you talk at all about what actions were taken with the two people who tested positive when they arrived in Bermuda, or provide some kind of general idea of what their interactions were like on the island after they arrived?
With right now, we will have the opportunity. As you can see, the health department team is not with us for this particular interview. And I've made it clear at the beginning, this is an operational briefing. The Ministry of Health team, they have their feet to the proverbial fire. Mm-hmm. And so what we have advised them to do is to focus on planning, to focus on everything that we have going on. And when it is the appropriate time, you'll be able to sit down and give a clear briefing of the specifics of this particular matter. But as you can imagine, we have limited resources. We want to make sure that the personnel are focused on going forward, protecting this country, protecting this community. And we felt that the best use of the resources at this moment was to have them to focus on the task at hand.
Earlier this week, we heard that the island had 90 kits on island at that time. Do you have an updated number as to how many test kits are on island?
No, that's health department.
I can say that more tests have arrived on island. We can confirm and have for you at our next briefing how many tests, the actual number of tests that have indeed arrived on island. The good news is that the tests have arrived on island.
Okay. Something else from earlier this week, it was suggested that, or even said that on-island processing of COVID-19 tests would begin locally in Bermuda
Yes,
beginning this week. Is that still the case?
that is still the case.
Is that tomorrow?
I do not know the exact time. I can tell you that we will have the ability within the not too distant future to commence testing on island.
Okay. A hard time and date for that would be better put to the Ministry of Health.
What I can tell you is that this is an operational briefing. We will let's just talk about establishing a battle rhythm. The battle rhythm is the PERT, the public health emergency team that will be dealing with putting together all the medical elements of it. They will meet at between 8 and 9 o'clock. They will give us any indication if there's been any changes, if there's any spike, if there are any new cases, if there are any elevations in any community transmission. Based on the information that they give to the Minister of National Security, I will then, every day, we will have the EMO at 10 a.m. At the EMO, Emergency Measures Organization, at 10 o'clock in the morning, we have all the key stakeholders, as you know, in the room. We will go around the room systematically. You'll get the information that includes the medical information, and we will make decisions on how do we continue the trajectory, how do we escalate, and what do we do differently based on the information that we're getting from the medical team. And so the purpose of this meeting is that we have the EMO briefing today where we talked about the operational pieces, and without delay, I wanted to make sure that the public had the operational pieces. We will daily have the public health meeting in the early part of the morning at 10 o'clock. We will have the EMO meeting at 12:30 or thereabouts. We will do the press briefing. Now, today we were a little late starting, and I've seen online where people are getting upset, they're getting frustrated. We are talking about a team that are synthesizing, that are putting together large amounts of information from a number of different stakeholders. They're getting back to the office, they're putting this information together, they're sanitizing it, they're putting it in a press briefing. And sometimes we are struggling to meet that 12:30 deadline. But that is something that we will continue to say approximately 12:30. But I want you to help me to understand the battle rhythm. 12:30, put it in your diary or thereabouts. We will have a press briefing at 4 o'clock. It might not necessarily be a press conference. It might be a press statement, but we will give you a press statement. If there is any other information that comes out in between that is significant, another case, something we alert, we will bring it to you as soon as it is practicable. We believe being transparent, being timely, and getting the information out to our key stakeholders, that we believe will be the strength of us getting through this together.
I just have a couple more, if I could.
Please, we have all the time in the world for you, sir.
Appreciate that. You mentioned in your prepared remarks that Ministry of Education was working towards online learning. I think this is something, certainly now that schools are closed, a lot of parents in the community. Is that looking like something that's going to be up and running soon? Are you able to provide any details on that?
I can simply say that there are a few elements to this. There is a curriculum piece. There is making sure that we have this morning in our EMO
something, certainly now that schools are closed, a lot of parents in the community. is that looking like something that's going to be up and running soon? Are you able to provide any details on that?
I can simply say that there are a few elements to this. There is a curriculum piece. There is making sure that we have the back this morning in our EMO